I feel like this was so meaningful for so many of us who attended the workshop in Helsinki. That we are dog people. IPFD is fundamentally for dog people, and we are koirai misile, koirai misile. I hope my Finnish is understandable by at least one of you. But this was something that the wonderful library in Helsinki had a fantastic art piece that talked about who the library and who Finland is for, and it really was for everybody. And the fact that they included dog people in that was really meaningful and kind of set for me and for others who were at that workshop after so many years of not being able to do one in person, really set the tone for that collaboration and who we are really, really for, which is for dogs and for dog people. So as a little progress summary, I'm with Eddie this morning, who it's always frustrating that we can't do more and faster all the time. I am also someone who is energized, personally maybe impatient, but it is great that we're able to gather and kind of reaffirm. We're wanting to talk about what IPFD has done and also acknowledge what has not been done and try to find some ways to move forward in those endeavors. So from IPFD, just a little summary for those who weren't able to join us. We had around 120, 130 representatives and leaders across key global organizations in the canine health, welfare, and well-being universe that were able to join us in Helsinki. As in previous years, we included a mixture of kind of educational or updating presentations, interactive sessions, and our traditional kind of 4 themes format. We're also very pleased to have a poster session and exhibition that kind of facilitated those networking opportunities and gathering opportunities for information exchange, both in terms of recent canine research, but also in connecting with genetic test providers and other industry partners who help support a lot of the work that we are undertaking as dog people. We had a gala dinner and our first inaugural awards ceremonies. We had been celebrating our 10 years as IPFD, and there were many people that deserved acknowledgement and just formal recognition for their dedication, both in terms of how they contributed to IPFD directly, but more broadly in the dog world. Oh, is that moving forward? Oh. Sorry, so there we all are, our little happy faces, many of us who are able to attend today, and a little reminder of our 4 themes. Post-workshop actions by IPFD, we often are nominated by the actions out of different groups as people who should be undertaking some of the work, or at least helping to organize that. So our update so far is that, we tried to work to connect some of those post-workshop kind of collaborations to greater or lesser success as time and kind of energy allowed us to do. We did, thanks in no small effort to Katarina Mäki, who is one of our consultants, produced a post-conference manuscript that was published in Companion Animal Health and Genetics. We also produced a number of post-conference articles and some media coverage across different languages. And we then spent much of our efforts developing and hosting this virtual dog health workshop that you're attending today. Sorry, I'm a little bit slow with moving my presentation on. That's annoying. Oh, there we go. So this is the manuscript, and you'll also see on the right-hand side, Dan O'Neill very kindly helped produce a infographic that we were also able to share based on those events. Apologies for this jumping around a little bit. Additional actions IPFD has undertaken. We had have had a complete update and overhaul of dogwellnet.com, which is our online platform to accommodate lots of different usages that we will be hoping for in the near future. I will have a separate presentation on that because that is quite an in-depth discussion. One of our actions was also to try to have a greater engagement with North American participants. We have made many strides in trying to connect, particularly with the AKC. And as you've already seen, we've had our wonderful presenter from OFFA. And I will also be attending along, I believe, with Mark Ralsky, the CHF conference this August. So I will definitely be going and seeing some of the presentations on the respiratory scheme that Eddie talked about earlier. And you are also invited to come and hear me talk more if you just can't get enough of my my speaking style. We are also in initial planning discussions with our contributing partner for the 6th International Dog Health Workshop in 2026. We are already in the planning stages, so potential speakers, look out. We're going to come and get you and try to entice you to come to Bologna, which I feel probably won't be that hard to convince you to do. And I very recently and earlier this May had an outreach meeting with genetic test providers to try to reconnect and build some greater engagement from that particular collaboration group. Still to do, apologies. We are a little bit slower in kind of developing some of those collaborations that were recommended, particularly with researchers and other stakeholders. It's been quite a busy year since the previous meeting, but we're hoping maybe some of the energy that comes from today and tomorrow will help with those initiatives. We really want to make sure that we keep these meetings regularly, whether in a large group like this every now and then or in smaller, more bespoke groups, whether that's kind of virtual or if there's a way to support other collaborations that are being built that IPFD can kind of host or help with hosting, and try to share those successes as well where they exist. We still have more information on practices and schemes by kennel clubs that we would like to include in our health schemes databases and look to support that big data, particularly with the way our new website will be functioning to help create that library of scientific papers and lay summaries that were recommended in the last workshop. Again, kind of sticking with a bit of a theme, collaborating with North America on resources. I know OFA has wonderful breed health templates that may be shareable, and other groups I'm sure have similar resources that we could help kind of support each other to help find all of the tools and resources that are available in our respective countries. We are still in the development of that searchable list of big data sets that was suggested. Again, that will be positively impacted by our new website. And we're still investigating maybe additional rewards or acknowledgement for programs that are of particular interest to this group that we feel like we really want to support, for example, crossbreeding or health project. So all these that I've listed of the still to do are direct suggestions that came out of the last meeting as areas that IPFD may be able to support in. Finally, just sorry to end on a little bit of a downer, but still to do some of our limits to progress. We are a small group of consultants, so funding, whether in term and directly relates to our time and to other resources that we can tap into, including kind of hiring any additional help. We recognize that we are very much a volunteering collaborative situation, so external collaborators also have limits and other priorities which can kind of slow us all down. Some of the things that we've mentioned that we would have liked to achieve are just simply still in progress, particularly related to utilizing the DogWellNet website. As I mentioned a couple of times already, our website and data collection is a big project. It is still ongoing, and we wanted to make sure that we were building something that would be able to accommodate the increasing databases that IPFD may be asked to kind of support. Some things that are just a little bit more esoteric and less practical that are limitations to progress, and I feel like this applies to us at IPFD, but maybe more broadly across the audience here today, is sometimes it's kind of we aren't sure who is actually leading various collaborations, or maybe they're kind of hard to reach, or we just have kind of time and energy limits, whatever our best of intentions are. And then speaking quite personally, I think we can all kind of run victim, and I am very much in this camp of sometimes a blank paper syndrome. You know, we have a good idea about what we would like to do, or we see a need that we would like to meet, but actually putting that to paper or getting kind of a project from nothing sort of started or kind of kicked off can be a little bit overwhelming or a little bit intimidating.